I want to welcome you to the Courage to Love, exploring relational strategies for promoting health equity. And we use the terminology equity on purpose, and I want to make sure we understand the distinction because otherwise this whole conversation won't make a lot of sense to you. One is that we often equate equality and equity, and they are not the same. And this picture actually shows us that they're not the same. So if you give everyone equal platforms and they start off in different positions, they will never get to equality. Whereas if you understand that people come with different resources and different capacities and you give them what they need, you can get them to the same place, equity. Okay, so we use that terminology on purpose. And that's really what we're interested in is equity. We're not interested in people not getting to their fullest potential, what they've been gifted with. Today, I'm welcoming you on behalf of our sponsors today. We have several sponsors, Advocate Children's Hospital, Become, which is a community organization, the Greater Auburn Grushin Community Development Corporation, which is a collection of organizations, the Sabina Community of Faith, the Center for Faith and Community Health Transformation, which is a collaborative between Advocate Healthcare Systems Partnership Office, Congregational Partnership, and then the Community Engagement Office of the University of Illinois, which is myself and Reverend Kirsten Peachy is from Advocate. EverThrive, and you'll know a little bit more about that today because Sissy is going to be moderating the panel. And then the Advocates for Community Wellness, Wholeness, Integrative Wellness, that's Dale Kane, who is a part of our collaborative but not here today. So on behalf of all of those folks, I welcome you to this session. And we're excited. You know, those are the organizations we come from, but I want to tell you a little bit more about us and what drives us. So who are we really? We happen to work at organizations, but we are a conglomeration of people. We're scientists, public health professionals, physicians, nurses, social workers, ministers, theologians, and advocates. And what's not up there is we are compassionate people and people of faith for the most part. So what I want to take you on is a short journey before we actually get into the meat of today, so you kind of have an idea of where we've been and how we've arrived at this space. So we're curious people, and we ask this question, which is often asked by some warriors in Africa. They ask the question, how are the children doing? And it seems like a strange question for warriors to ask, but they're very concerned about the well-being of the children. And as a society, we often say that the state of our children actually reflects the state of the society at large. If the children are not well, we are not well. So we know a lot from public health science, and I'm going to briefly go through an annotated version because I could talk about public health all day, but we're going to go through an annotated version. What do we know? We know when we look at infant mortality. How many people know what infant mortality is? Okay. It's an infant who dies before they're able to celebrate their first birthday. The United States does not look good. We're the light blue color at the end. When we look at a global community, we're not doing well, okay? So the children are not well globally. And then when we look at the U.S. infant mortality rate, and we're looking at this by race and ethnicity, we see that there are differences in the rate at which infants are dying before their first birthday. And what's obvious here is that what people call non-Hispanic Black, that's the label that's been given, are worse off than other groups. And what is not here that's worth noting is that while Hispanic and other groups, as they come here as first-generation immigrants, the infant mortality looks fairly good, looks similar to at least the non-Hispanic whites. But the longer they stay here, the worse their outcomes begin to look. And this is Chicago, just to give you a picture of what's happening here. We're not different from what's going on nationally. We still have the disparities, and still we have black babies doing worse than any other group. And then if we look at this geographically, this is a map that was created by Chicago Department of Public Health. And what it attempts to depict for you is what infant mortality looks like across the city. The city has 77 designated community areas. The community area that our project, The Courage to Love, is focused on is known as Auburn Gresham. And so I have an arrow there. It's community area 71. Nope, not gonna work for me. But you can see it's in this lower corner where the arrow goes across. That's the community that we are working in, because it is one among the communities that has the highest rate of infants dying before their first birthday. So some of what public health science tells us is that babies are not dying in the black community because they are genetically different or deficient in comparison to their white counterparts. But we also have to consider the social context within which it happens. So there are a number of factors here, and they don't explain them all, but they at least give us the idea that what happens in the social context, in the environmental context, influences birth outcome. And the other point of this particular pyramid is to say that if we start working on the socioeconomic factors, we can have a larger impact than if we stay at the point of counseling and education, which is where a lot of work is done. But in fact, if I just keep talking to you and trying to help you as an individual, it doesn't do much for the entire population. But as an example, we could talk about the Affordable Care Act. The Affordable Care Act increased access to prenatal care for many people who could not afford care prior to that. That's a public policy change. And so we can have a larger impact. And not that prenatal care is the total answer, but it's part of it, particularly for those women who have a pre-existing condition. We also know, for instance, that in general in Chicago, black infants are more than 2 times likely to die before their first birthday than white babies. We also know from some science and research that's been done by Dr. David Williams that money's not the answer, because we often think that if we can put more money into people's hands and we can give them jobs, that we will solve the problem. So his research, where he did an analysis and control for all those factors, found that we still cannot eliminate the disparities that we see. So there's something else going on. And being a curious collaborative, we kept asking the question, so what else is there? So what do we believe? So we believe that these inequities are immoral. They're unjust. They should not exist. Would you agree? Every baby should have the opportunity to live past their first birthday. And we believe that we have not been left without a solution. There is a problem and a challenge before us, but there is also a solution. And some of this comes out of our faith traditions, you know, where I would say, and from my Christian tradition, that all things are possible. Okay? Social cohesion, and we call it love, because the social scientists talk a lot about social cohesions and people's connection. We call that love in our theological language, provides a powerful tool for transforming the situation and the environments that we see and the relationships that we see. And that we believe people are wise and powerful. People often know what they need and what those solutions are. Do you believe that? They do. Test it out. People know. Just try listening. So there is good news, we think, and we think the good news is love, this social cohesion factor that is not often talked about. This is why we're so excited about Dr. David's study and his research, is because it lifts up something that we don't often think about. So when I showed you that pyramid and you see all the various areas that you could work, socioeconomics, the policy, none of that happens without a loving relationship in a just and righteous way. We got plenty of public policy, but it's not love-driven, okay? Such as the discussions that are going on in Washington now. So this is the report that you probably received this link to the report, if not, to read the full report. And Dr. David is going to share some of the findings from that. But this is the report that we fell in love with, called The Courage to Love, the Infant Mortality Commission. We began our journey as a collaborative really listening to the community. Remember, we said we believe the community is wise and they know what needs to happen. And we're still on a listening tour. And you will get some listening opportunities today because we've invited a community resident to talk about, her journey. Because you can't solve something unless you know what the story is. The statistics don't tell you half of what we need to know to be effective in our relationships and in our efforts to try to help people be and support them in being all that they've been created to be. So we've been at a lot of events in the community. We've listened at the Renaissance Festival. We just put up a table and put some trinkets out that will attract people. And they stopped by, and so we had questions that we asked folks. One was, we recognized that while this community had a lot of trouble, and the infant mortality was a disgrace for a developed country, we also recognized that there were good things happening in the community, and there was love in the community. And we wanted to know what the community's views were. How did they understand love? What did it look like? Where was it? And so we did a lot of listening. And these are just some of the findings, but if you go to the Center for Faith and Community Health Transformation's website, you will find other, a more detailed list of the findings. And I just lifted up a few of them. So, love is walking down the street and people speaking to you. Recognition. I am human. Okay, that's what that says to me. I am alive. I am of value. Love through youth programming, food pantries, daycare, meeting people's basic needs. Playground children playing together, churches forgiveness, hospitals healing, ambulances, so it's getting help when you need it. Friends, having connection. We as human beings are really social beings that have a yearning to be connected. And there's good science, and I'm not going to go into all of that science, not only connected to each other, but connected to something beyond us. We have that yearning in us. And so when that is fulfilled, people feel love. Unity in the community is love, when there isn't any quarreling between people. Okay? Love is the parks when we have cookouts, so being together, being connected with folks. I see love in our home and in our community, and I feel love in my school where I'm safe. This was a child. So we had adults, we had children, we had men, we had women who stopped by the table to tell us what they thought. So we are continuing the journey. And we invited you to come on the journey so you would kind of know where we've been. And maybe some of you will be so inspired you want to even join us in the labor on the journey. And we continue with our research partners to really try to understand, find ways to gather community wisdom. We have an event happening tomorrow for women and girls who live in the Auburn Gresham community to share our findings with them, validate those findings, and to ask them, how do you think we can expand the love in your community? Our hope and our prayers that we will be able to come up with beginning conversation and eventually end up with a prototype and a model that we can actually implement in the community to see what difference that makes in the community. And it's going to be a long-term journey because it's not going to just turn around on a dime. So we have to have a long commitment to this, and I think we do. We've been out there at least 3 years now, and nobody's turned away. In fact, people are beginning to join us.